So before we come to the doctors, let's just look at the daily COVID cases. In India, December 14, 200. December 15 came down to 162. December 16, 167. December 17, 176. December 18, 135. December 12, 112. December 20th, 131. This is effectively suggesting actually that COVID is completely under control for now in the country. Daily COVID deaths, December 14, 5. December 15, none. December 16, 4, December 17, 5, December 18, 2, December 19, 3, December 20th, 3. So effectively it appears from the last week's data that COVID appears under control. But can we really be complacent? What should be the protocols? Dr. Hemant Thakkar, consultant physician and someone who's been tracking COVID for us from Mumbai, joins us. Dr. Vishal Rao is member of the Genome Surveillance Committee, Karnataka, with us. But first you, Dr. Thakkar, do you believe that we need to bring back COVID protocols, particularly masking, social distancing, given what's happening in China, or would that be a panic reaction? Because for now, even at airports, masking is optional.
So definitely there is a huge surge in China, which is spilling over into Korea, Japan, Singapore. Even the US and Brazil are reporting numbers. The fact remains that an ounce of prevention is better than a pound of cure. So I would say, at least in public places, what the health minister has egged on today is that people should be vigilant. And if you ask me, I tell all my patients that there's no harm in wearing the mask at public places because it's not COVID alone. It's the RSV virus, H1N1 virus, pollution-induced all the throat problems, all that would be looked after. I'm not asking you to put a stop to the New Year parties or don't go out. But if you have large groups, airports, exhibitions, conglomerated parties, you might want to think twice. Because China is the one where the epicenter was last time, and China is again the epicenter. Because if you do what you did, you will get what you got.
No, but let me get this very clear, Dr. Thakkar. Are you calling for a return to COVID protocols that existed in 2020 December and 2021 December?
I am not calling for any compulsory protocol. I'm only asking for vigilance. People who are in the know of the matter will say better to mask than to unmask and walk with flagrant carelessness. Because the mask helps you in all the respiratory viruses. And this direct flight not being there doesn't mean anything, because you can get the Chinese virus. You see, there's a COVID variant which is going around, and COVID variants are going to abound. I am not pressing the alarm bell. I'm not telling anybody that we will have strict protocols. But in order not to return to those protocols, we have to be a little careful. We have to be a little, shrug off this complacency and wear masks at public places, especially airports and stations, and you will remain protected. The vaccination program in our country has been so stupendously successful, and the Delta has gone and vaccinated the whole population, which China did not do with their zero COVID policy. So China decided to strangle the virus, and this virus doesn't get strangled. It went from place to place every time you strangled it, and it became stronger. On the contrary, when you have a great spread of the virus which happened in India, the virulence goes down. So the immunity and herd immunity is phenomenal, along with this vaccination immunity.
So given that, Dr. Vishal Rao, do you believe that some of the responses at the moment suggest panic? That when I showed those numbers, it appears COVID is completely under control. By contrast, of course, there's this surge in China. Should we, as Dr. Thakkar is suggesting, just be vigilant rather than impose forcibly any protocols at this stage? Because I asked the politician, there is no formal letter imposing fresh protocols. What, therefore, should India do at the moment?
Thank you, Rajdeep. First of all, I would not want to sound like a pandemic alarmist every time I appear on the show. But I think the global trends that we are seeing today obviously seems to be seeing a surge in many of the Omicron variants. Now, if you look at the variants of interest, it has been the XBB, the 2.75 and the BQ1. There are a couple of ones which are being closely monitored. But the BF7, the current one that's being talked about in China, is simply a variant that needs monitoring. There does not seem to be a need to hit the panic button. Now, China has been in this position for various reasons. One of the things is the stringent policies. The second thing people are discussing about the inactive vaccines that they've used because of vaccine nationalism. So there are various factors that China is going through this entire surge right now. And while India has accepted a larger aspect of accepting endemicity, another important aspect that we need to know about Omicron is that it lacks the temperance pathway protein, so it doesn't affect the lungs too much. So we are not looking at a scenario like Delta. We are looking at a scenario here where there is going to be some amount of infectivity, which is what globally they are talking about, but they're not talking about death tolls, hospitalization. So this should not send out a panic wave to the citizens. But this definitely is an important aspect to highlight on one important point, that the war is far from over. There are two important points that have come out of the evolving discussions of late among the scientific world. One is that the virus continues to create recombinants. That means two variants go inside the cell and come up with a third variant. And second is something called as antibody enhanced disease. We have to remember here that the vaccines that we have used are of the D614G, the Wuhan variant, which was the first variant, the first version. Now, if I'm talking about it, like in a simple analogy, it's like I'm saying I'm using the iPhone 1, but the iPhone 14 is out there. So the versions of the virus are very rapidly changing. So it's very important that, like the way we followed up in flu, that every 2 years we will need a new vaccine in endemicity, we eventually will move towards the same part of endemicity where every couple of years we'll require a completely new version of the vaccine. And until that time, precaution is mandatory and needs to be followed.
So are you suggesting that suppose someone like me has taken a booster 6 months ago, are you suggesting a fresh booster dose?
Absolutely no. In fact, there is enough of studies that show that increasing the booster does not improve the immunity. And I think Israel is a classic example when they went for the 4th dose, or even the complications that the mRNAs are witnessing in USA because of myocarditis and other things.
Right.
So I think overdoing the vaccine is the wrong way. I think allowing the virus its natural course while we take precautions would be a more logical path.
You know, given that, Dr. Thakkar, therefore, in conclusion, what is being suggested is be cautious, don't be complacent, but clearly this is not a moment to, in a way, abandon your saying the path that we have taken over the last few months, where we are going into large gatherings, we are carrying out large gatherings. Am I correct in saying that we can continue now with the way of life that we have had over the last 6 months? We don't need to put a red flag just yet.
I agree with you. Continue life as you've been leading. But this last bit that we have, that you can go to malls and airports without masks, maybe voluntarily let common sense get the better of you, get prevention get the better of you, and wear masks in these large gatherings. Enjoy Christmas, enjoy New Year. Remember, this virus is a serpent. And like last time, it can slither in and give you unnecessarily trouble.
Okay.
It's not going to take your life away, but it's an irritant, and you do not want to flirt with this irritant. So be careful. That's all I'll say for the moment, until we have more genome sequencing and until we have other policies coming in. Made in China, so keep away from all the flights of China and other people who have been there. That's all my messages.
Okay, let's leave it there, Dr. Thakkar. I'm sure we'll come back to you with more as the situation evolves. Dr. Rao, Dr. Thakkar, I appreciate, as always, expert voices. So much better to listen to you all at times than politicians fighting with each other.